Bismillah ar-Rahman ar-Rahim. Disaster Management Plan in Al-Qatif Central Hospital. What is disaster? Any destructive event which produces a large number of casualties more than the hospital and emergency department standard capacity. The hospital will receive a call from four main sources: the Regional Disaster Committee, Red Crescent, Civil Defense, Emergency Safety and Ambulance Services Administration. Also ED shift team leader, switchboard operator, and then they will call back to confirm. ED shift team leader will call nursing supervisor. Then they will make a decision: Hospital Disaster Management Plan or ED Major Accident Plan. They will initiate the alert. Yellow alert overhead paging, code number 777 on pagers, and they will call back to confirm a presence, and then they will go to auditorium. The first doctor of the disaster control team will act as hospital controller until the arrival of the medical director or hospital director, who will then take over. Remain at yellow alert until more information are available. Activate a pre-hospital disaster team mobile medical aid team. Proceed to red alert status on the basis of available information, or step down the yellow alert and leave the incident to be dealt with by the ED Major Accident Plan, or to call off the alert completely. Red alert overhead paging code 888. Red 1 alert disaster incident of 50 to 100 injured victim. Red 2 alert disaster incident of 100 to 500 injured victim. Red 3 alert disaster incident of more than 500 injured victim. A pre-hospital disaster team. 4 doctors: ED shift team leader, on-call anesthesia ICU, on-call junior general surgery resident, on-call orthopedic resident. 5 nurses: staff nurse from MSA, staff nurse from MSB, staff nurse from FSA, staff nurse from FSC, staff nurse from male medical ward. Triage area in front of ER reception. The RR female exam room area will be cleared for the management of priority 1 and 2, those requiring immediate life-saving treatment and resuscitation. The male exam orthopedic room and treatment room yellow zone. In front of old ER reception green zone, those with minor injuries. Non-disaster trauma or patients arriving to ED during disaster alert will be triaged in ED. As for disaster victims and treated, all ambulatory stable ones will be directed after that to go to the ER primary clinic. Dead victims after triage will be sent to the physiotherapy area after alert end to mortuary. During the alert, hospital director office is the hospital controller office, nursing director office, and reporting room of staff that may be needed. Also available are 2 clerical staff, hospital director's secretary. Triage team. Neurosurgeon consultant on call, general surgeon on call next day. Other members: orthopedic specialist or consultant on call, plastic specialist or consultant on call, ER resident, medical resident, 5 nurses, 5 porters. Triage tag. Priority 1 red, case in need of immediate simple care to save life, very good chance to save life, tension of pneumothorax, respiratory distress, shock, airway injuries. Priority 2 yellow, delayed care, permissible, will not change result, major multiple injury with a fair chance to save life, severe head injury, severe chest and abdominal injury, big bone fracture and open limbs fracture. Priority 3, green, minor care, ambulatory victim, minor contusions, small bone, closed fracture, lacerations and abrasions, burn less than 10%. Priority 0, black, expectant, dead or deceased victim, lethal injuries, devastating head injuries, major third-degree burns over the most of the body and destruction of vital organs. Each victim during alert status entering to ED will be triaged at a front ER reception area, and a triage tag will be attached for each victim. Priority 1 staffing, consultant general surgeon on call, consultant anesthesia on call, consultant neurosurgeon on call, consultant cardiologist on call. Consultant physician on call on the same day, consultant thoracic surgeon on call also on the same day. 2 residents, general surgery resident on duty on the same day, both junior and senior medical resident on duty during working hour and senior only after 4 p.m. inside the female exam room. 15 nurses led by the charge nurse in ER, 2 RT technicians, all ER physicians on duty, medical record officers, security officers, maxillofacial surgeon in RR. Priority 2 staffing, consultant urology on call, consultant or specialist general surgeon on call, consultant physician on call, consultant orthopedic on call the night before. Ophthalmologist resident on duty in the same day, orthopedic resident on duty next day, ENT resident on call same day, pediatric resident on call same day, medical resident, surgical resident on call next day before working hours, 10 nurses, medical record officer, 2 security officers. Priority 3 staffing, medical ROD, nephrologists on call, ophthalmology resident on duty the next day, medical ROD, 3 nurses, 1 social worker, medical record officer, female security officer. Black zone, 1 nurse, 1 mortgage officer, medical record officer. Operating room. It is the responsibility of Chief of Surgery and Anesthesia to arrange for the required staff according to the next table. Operating room will be arranged according as the table showed. Upon notification of disaster alert, an up-to-date list of empty beds and those agreed for discharge should be forwarded to the bed bureau. Discharged patients are to be taken to the admission and discharge office under supervision of 1 resident in medicine and 1 nurse to be picked up by families. On activation of the hospital disaster control plan, the chiefs of surgery and medicine will assign 1 consultant physician and 1 consultant surgeon to assist the remaining patients in all wards and discharge all patients who can safely leave the hospital. Patients unable to be discharged from the wards will be transferred to empty beds on other wards as possible. A green alert. On an instruction from the hospital controller, a switchboard operator will call code green to clear code number 000. مع تحيات قسم الطوارئ في مستشفى القطيف المركزي.